So another common question that patients ask, I'm sure it's one of the things that's on anyone who's considering an implant, it's like in the forefront of their mind is this gonna hurt? Do implants hurt? And the answer to that, unfortunately, is a little bit complicated. It's not easy to answer. Everybody has a little bit of a different pain tolerance. Some people, they get a splinter in their finger and it bugs them until it's out, and some people they don't even notice. That's part of the problem. Answering that question is it's really a little bit individual. But I can give you an idea of generally what most people kind of experience. So for a single tooth implant, there are a couple factors that help we kind of predict the amount of pain that you're going to have. One of the biggest ones is, do you need a tooth taken out? If you have an immediate placement implant where you take a tooth out and put the implant in the same day, having teeth taken out is a little bit more painful than having implants. So generally speaking, you're going to be a little bit more sore. What are we talking about? Usually it's a few days. Usually the first 2 to 3 days are the worst, and then after that it kind of starts tapering off. We always offer medications that can kind of help, like ibuprofen and Tylenol. Those kind of reduce the inflammation, the swelling, help make the healing process go smoother. Patients who get extractions, we always offer a prescription strength pain medication as well. The other things that can kind of predict how much pain you're going to experience is how much work you need. Somebody who needs implants on different areas of their mouth is going to have more experience than someone who just needs one implant. So one of the techniques that we try to use to help reduce the negative experience that patients can have because of the pain is we usually try to limit our work, what we're doing, to one half of the mouth. Basically, we want to give you one good side to chew with. Chewing, talking, those are things that we do every day and can't really live without. So we want you to be able to do that while you're going through the implant process. For example, a patient like this who needed several implants, he chose an option where he wanted a full fixed, he wanted something that was going to stay in, didn't come out. And so it was broken into different units, different bridges. So something like this, we would try to split him into half and do half on one day, half the other, half after 2 weeks after he's had some healing time. And that helps a lot because he doesn't have to just drink smoothies for 2 weeks while he's healing. He can actually eat some real food. We tell him softer foods, but he can eat. So that helps as well. Again, I mentioned the medication like ibuprofen, they're anti-inflammatory. So anytime you have, an implant placed, it's an injury, it's a wound area in your body. And so there's going to be swelling, inflammation. So medications like ibuprofen can help reduce that. So there's all these different techniques that we try to use to help make it as smooth of a process as possible. Having an implant placed is a little bit painful. While you're having it done, you'll be completely numb. You will be sore for a few days. That's sort of a normal experience. But other than that, it's a little bit individualized, and it's difficult to say exactly what your personal experience will be.